great. I just want to ask maybe one question to the. I was in Puerto Rico the whole month of July, and there's a documentary that came out that since Walmart and Monsanto have been in Puerto Rico, the increase of cancer and asthma has more than tripled. Monsanto and Walmart practically own the whole island, and so they're polluting the land. They kill all the small farmers, and they also control the pharmaceutical. So what are we going to do? I mean, all the money that we come from research, but when these corporations have the power to do exactly the opposite of what you're doing. Next week, we have this great man, John Retief. He's an expert on mass senior action with the Alliance for Retired Americans.
It's amazing to me sometimes, this panel starts at pre-kindergarten, and now you're getting to the achy knees, the people who suffer from Alzheimer's. But there are a lot of common themes that run through it that I think are important. I couldn't believe it the other day. I got a call. I'm with two organizations. I'm with the Mass Senior Action. I'm one of their officers. And they've been part of the moral budget activities. We have tried to make sure the senior voice is elevated as part of the coalition. And I'm also with the Alliance for Retired Americans, which grew out of the labor movement and is trying to organize union retirees and other retirees to face the common problems that we face as elderly. Both organizations work with each other. Some of my brothers and sisters from Mass Senior Action, there's a woman who's about to retire, lives in Somerville, came here from Haiti and began playing a leading activist role in the community, discovered there were opportunities to advance her education, to have a better part in life. So she went back to school kind of at an older age. She took out student loans to do this. Now she's approaching Social Security age. She's finding out that her Social Security is going to be docked or reduced to $750 a month to pay student loans that she got so that she could be a social worker to help people in her community, when she came over here. And I was so amazed by that. I talked to another person in the leadership of Mass Senior Action and found out that he was in that situation too. There are a lot of seniors around this society who are suffering from that same student loan crisis. So that's like one of the common threads of need that we have. What I've been assigned to talk about, though, is another one that we have from the cradle to the grave, and that's healthcare. And we've done a particularly bad job of providing for that. And I see 3 T-shirts there I recognize that can probably give this talk much better than I can, because they're in the front lines of trying to provide healthcare from $11.99 out there. But my working life was spent working for another SEIU local down in Miami that was a nurses local and medical health professional local at a public hospital. We had, it's amazing how things sort of repeat themselves. A lot of my life was spent fighting privatization of the public hospital because it was, for some people, they saw it as a profit center that they might look at. And each one of us, for that matter, is a profit center coming into healthcare for somebody to make a bunch of money off. And how did they do it? They do it by underpaying the providers of the health care, and there could be no better example than that, than the people who provide in-home services or nursing home services for the elderly, who are providing a service without which it would be total misery to age in this country. And they are one of the lowest paid for the services they get. And that's 1199 has been fighting to turn that around. It's an important battle. So that's one place we need a huge infusion of funding to pay the people who are providing the real health care. I heard somebody mention prevention when the last talk was occurring, and that's part of the research I think my sister was talking about when she was up here. Because in addition to cures, if we find out what causes the ailments, we might take preventative action to stop bad actors like Monsanto just running roughshod over the providing of nutrition and everything, so that we could maybe not get so threatened with these diseases, many of which have actually escalated. They say it's because we're living longer, but maybe it's because we're being exposed longer to the things that we don't need to be exposed to in the environment and so forth. So that research is very important in terms of aging with more health and more dignity as we go along without all of the ailments. You know, when you turn 70 and you're talking to your friends when you first see them, we tease each other that it's like an organ recital. Because everybody's got something, you know, acting up, you know, whether it's a knee or it's in the blood or it's something. It's a condition we're all living with that is in part a result of the lack of the proper priority being devoted to health care. And when you saw that chart that was up there earlier, you can see some of the reasoning behind it. And when you think about it, I think it was a real radical in there. Well, Gandhi is attributed with saying that you judge a society by how it treats the young and the old in the society. I've seen that attributed to other people too, but that's an important thing for us to think about when you think of a society. Those parts of our society that are less able to take care of themselves should be treated socially. My time is up. All right. I was just getting going, but I'll wrap it up with a couple of thoughts. You know, there's a lot of discussion about Medicare for all. That is something we really have to look at doing in this society. And while in time it will save a huge amount of money in our healthcare system, to establish it will require substantial investments in funding. So that's another thing that we need. And most of the countries in the world, in the more developed parts of the world, in addition to health care, provide for long-term care. Some kind of, and in this society, it's barbaric. You know, you have to spend everything that you've earned or accumulated out of your budget till you're poor in order for the state to pick up and pay too little for the care that you receive later on, all because it's run for profit. If we could take some of that money that we use to bomb hospitals and healthcare centers and schools in Yemen and use it instead to invest in this country, it would make a huge difference.
Yes.